This video outlines your technique for measuring meniscal extrusion using ultrasound in the setting of posterior medial meniscal root tears. Here are our disclosures. The materials needed will be an ultrasound machine and gel. This demonstration uses the Elsevier MyLab X8 machine and a high-frequency probe. We use the MSK preset, but other presets such as joint and soft tissue are acceptable and will depend on your particular device. We recommend positioning the patient in 30 degrees of knee flexion while weight bearing, as our previous cadaveric analysis showed this position to best facilitate visualizing meniscal extrusion in the setting of posterior medial meniscal root tears. However, if the patient isn't able to weight bear, they can rest on a nearby wall. If the patient isn't able to tolerate that, they can weight bear in full extension. The first step is locating the MCL. Begin by palpating the medial femoral epicondyle and place the probe directly over in the short axis plane. Look for a rounded echogenic image, which will represent the MCL. If unable to find, adjust the probe anteriorly and posteriorly. Anterior to the MCL, you may see the MPFL, and posterior to the MCL, you will see the posterior oblique ligament. Once the MCL is identified, rotate the probe 90 degrees such that it is in the long axis of the MCL. Move probe distally until you get to the joint space. Once at the joint space, tilt the probe posteriorly to be over the posterior oblique ligament and posterior border of the MCL. Freeze an image you are satisfied with and make measurements. Patient may relax now. Begin by finding the superior and inferior borders of the meniscus and identify the line in the middle denoted by average on the screen. Next, create a line parallel to the tibial plateau margin and the long axis of the image. Find the distance between lines 1 and 2. This will represent your meniscal extrusion. Here's a demonstration. The patient is weight bearing in 30 degrees of knee flexion. The medial femoral epicondyle is palpated, and the probe is placed directly over in the short axis positioned to look for the MCL. The MCL is identified. Anteriorly, we have the MPFL, and posteriorly, we have the posterior oblique ligament. Now that the MCL is identified, we will rotate the probe into the long axis position. And we will move distally to visualize the joint space and medial meniscus. We will play around with our probe until we find a good quality image. Now we will freeze the image and make our measurements. We will draw a line that follows the inferior border of the meniscus and another line that follows the superior border of the meniscus. We will now draw a line that goes through the outer edge of the meniscus. And another line that follows the tibial cortex at the articular margin. Once we have those two lines, we can make our meniscal extrusion measurement. Meniscal extrusion is a valuable, non-invasive diagnostic tool for meniscus pathology, and ultrasound provides the added benefit of providing instant results in the office. However, meniscal extrusion is a fragile metric in the degree of millimeters. The inconsistent techniques found to be used by different authors in the literature and the additional operator variability with ultrasound technology makes it important that a systematic approach is used. The purpose of this study is to propose one reproducible technique. Have the patient in 30 degrees of knee flexion while weight bearing. Place the probe at the posterior border of the MCL and capture an image. Use a reference line parallel to the articular margin of the tibia and measure meniscal extrusion at the midpoint of the outermost edge of the meniscus. Thank you.